My name's Tom Harper. I'm a living historian here at the Alamo, and today we'll be talking about surgery in the 1800s. Now, surgery was very much a last resort in the 1800s. It was quite dangerous for the patient and sometimes even for the doctor, and generally involved no anesthetic at all. The only painkiller of the day is something called laudanum, which is a mixture of opium and alcohol. But being alcohol, it is a blood thinner, so it would increase bleeding and therefore increase the likelihood of the patient dying. So often the only painkiller was a wooden dowel to bite on or a strip of leather. Now, the most common battlefield injury was amputation. If a bullet hits a bone, it's going to shatter the bone, and surgeons simply do not know how to fix that. Amputation would be done with tools like this: a capital amputation knife for the soft parts and a bone saw for the hard parts. The capital amputation knife would be cut around the limb in what's called the turno di maestro, the turn of the master, cutting as deep as can, then using a Catlin knife to cut away the connective tissue such as tendons and ligaments. Bleeding would be stopped by hooking onto the arteries with a tenaculum and then closing them either with a silk thread ligature or, more likely in the frontiers, by burning the wound shut with a cauterizing iron. This can, however, kill the patient through shock alone. Once that's done, the artery is let to retract back into the body and the bone is closed up after chiseling away any broken bone with a bone chisel. Now, after 10 days of surgery, patients are brought back to check on the wound, and if it is covered in pus, that's a good sign. That's called laudable pus. If there is no pus, the body is not fighting infection, and the patient will be dead in 2 to 3 days. Now, should the patient maybe take a little too much of the laudanum and become unsteady on their feet and hit their head and suffer bleeding under the skull, the doctor is going to use a trepanning saw and use this to bore down into the skull to relieve any pressure within. Once bored down, pressure will be released, but the patient will have a hole in their skull, and that needs to be blocked up. Now, a cheap man could live his life without being closed up, but if you're a more discerning customer, you're going to pay an extra $1, which we're going to put holes in, and then screw into your skull to close the hole before closing the skin up over it. You'll be alive, and you'll be worth at least $1 more.